Have you ever noticed subtle changes in the color of your skin, nails, or bodily fluids and thought little of it? What if those changes were your body's way of signaling something more serious, like cancer? It might sound surprising, but the truth is that cancer often reveals itself in unexpected ways, including through changes in color. Ignoring these visual clues could mean missing the chance for early detection when cancer is most treatable. Cancer, one of the most widespread and devastating diseases globally, doesn't always announce itself with obvious symptoms. Instead, its earliest signs can appear in the form of unusual color changes in your body that are easy to overlook. Would you recognize them? In today's video, we'll uncover 8 cancer-related colors that could be vital for identifying the disease early. Stay with us until the end. This knowledge could save a life. Let's dive in. 1. Yellowish skin or eyes. Yellowish skin or eyes, a condition known as jaundice, is one of the most recognizable signs of underlying health problems, including certain types of cancer. Jaundice occurs when there is a buildup of bilirubin, a yellow pigment formed during the breakdown of red blood cells in the bloodstream. This buildup typically happens when the liver, pancreas, or bile ducts are compromised, disrupting the body's ability to process and eliminate bilirubin effectively. Cancers affecting these organs, such as liver cancer, pancreatic cancer, or bile duct cancer, can block the normal flow of bile, leading to this telltale yellowish tint in the skin and the whites of the eyes. While jaundice is commonly associated with liver diseases like hepatitis or non-cancerous conditions like gallstones, its sudden onset should not be ignored. It is often an early warning sign of more serious issues, particularly if it is accompanied by other symptoms such as abdominal pain, dark-colored urine, pale or clay-colored stools, unexplained weight loss, or persistent fatigue. These additional symptoms suggest that the underlying condition may be progressing and impacting the body's overall function. Jaundice can sometimes appear subtly at first, especially in the eyes, before spreading to the skin. Many people might dismiss it as a temporary issue, or attribute it to dietary changes or dehydration. However, ignoring this warning sign can delay critical diagnosis and treatment. If you or someone you know notices a yellowish hue to the skin or eyes, especially when combined with other concerning symptoms, it's essential to seek medical attention immediately. Diagnostic tools such as blood tests, imaging scans, or biopsies can help determine the cause and guide appropriate treatment. Early detection of cancers associated with jaundice can significantly improve outcomes, making it vital to recognize and act on this visible signal from your body. 2. Pale skin. Pale skin, particularly when it appears suddenly or persists over time, can be an important visual clue to underlying health issues, including blood cancers like leukemia or lymphoma. These cancers often interfere with the production of red blood cells in the bone marrow, leading to anemia, a condition characterized by a reduced number of red blood cells or insufficient hemoglobin. This drop in red blood cells decreases the oxygen supply to tissues, causing the skin to lose its usual healthy tone and take on a noticeably pale appearance. The change is often most evident on the face, lips, and nails, where the loss of color is easier to detect. While pale skin is sometimes dismissed as a sign of fatigue or poor diet, it becomes more concerning when it is accompanied by other symptoms, such as extreme tiredness, frequent infections, or unexplained bruising. These additional signs indicate that the body's immune and circulatory systems may be compromised, as blood cancers can disrupt not only red blood cell production, but also white blood cell function, leading to weakened immunity and increased susceptibility to illness. Bruising may occur due to a reduction in platelets, another critical component of the blood. If you notice persistent paleness along with any of these symptoms, it is crucial to seek medical advice promptly. A healthcare provider may perform a complete blood count, CBC test, to measure red and white blood cells and platelet levels, as well as other diagnostic tests like bone marrow biopsies or imaging scans to identify the cause. Early detection of blood cancers can significantly improve treatment outcomes, making it essential to recognize pale skin as a potential warning sign and take timely action. 3. Darkened skin. Darkened patches of skin, a condition known as hyperpigmentation, can be a subtle but significant warning sign of adrenal cancer. This type of cancer affects the adrenal glands, which are small but vital structures located above the kidneys that produce hormones regulating essential functions like metabolism, blood pressure, and the body's response to stress. Tumors in these glands can disrupt normal hormone production, leading to an overproduction or deficiency of certain hormones. This imbalance may manifest as darkened skin, particularly on the palms, knuckles, elbows, and other areas of the body prone to friction or sun exposure. This hyperpigmentation is often associated with a condition called Addison's disease, which occurs when the adrenal glands fail to produce sufficient hormones due to dysfunction or destruction by cancer. The darkening of the skin may be gradual and subtle at first, causing many people to dismiss it as a normal variation or a result of sun exposure. However, when it appears alongside other symptoms like muscle weakness, unexplained weight loss, low blood pressure, fatigue, or dizziness, it becomes a more pressing concern. These symptoms indicate that the body is struggling to maintain balance due to the hormonal disruption caused by the tumor. Adrenal cancer is rare but aggressive, and early detection is critical for improving outcomes. If you notice persistent darkening of the skin in unusual areas, especially when coupled with other signs of adrenal gland dysfunction, it's essential to consult a healthcare provider promptly. Diagnostic tests such as blood work, hormone level assessments, imaging scans, or biopsies may be necessary to determine the underlying cause. Paying attention to these subtle but telling changes in your skin could lead to an early diagnosis and timely treatment, potentially saving your life. 4. Reddish skin. Reddish skin on the breast, particularly when it appears inflamed, can be a critical warning sign of inflammatory breast cancer, a rare but highly aggressive form of the disease. Unlike more common types of breast cancer, inflammatory breast cancer doesn't typically present with a lump. Instead, it manifests through changes in the skin, often causing a red, swollen, or warm appearance. This redness occurs as cancer cells block lymphatic vessels in the skin, leading to fluid buildup and inflammation. In some cases, the affected area may develop a dimpled texture resembling the peel of an orange, a hallmark feature known as peau d'orange. One of the challenges with inflammatory breast cancer is that its symptoms are often mistaken for less serious conditions, such as an infection or irritation. Many people initially treat the redness with antibiotics or anti-inflammatory creams, assuming it to be mastitis or another benign issue. However, redness and swelling caused by inflammatory breast cancer typically do not improve with these treatments and may worsen over time. The skin may feel thickened or tender, and the affected breast might appear larger or heavier than usual. Because inflammatory breast cancer progresses rapidly, early detection is critical. If you notice persistent redness, swelling, warmth, or changes in the skin's texture that do not resolve within a few days, it's essential to seek immediate medical attention. A doctor may perform imaging tests like a mammogram or ultrasound, as well as a biopsy to confirm the diagnosis. Recognizing these symptoms and acting quickly can make a significant difference in treatment options and outcomes. While inflammatory breast cancer is aggressive, catching it early provides the best chance for effective intervention and improved survival. 5. Blue or purple lumps. Blue or purple lumps on the skin, often mistaken for bruises or harmless discoloration, can be a warning sign of Kaposi sarcoma, a rare form of cancer that develops in the lining of blood vessels and lymphatic vessels. This cancer typically manifests as blue, purple, or red lesions on the skin, which may vary in size and shape. These lesions are most commonly seen on the face, legs, feet, or inside the mouth, but they can also develop in areas not visible externally, such as the gastrointestinal tract or lungs, where they can cause serious complications. Kaposi sarcoma is often associated with individuals with weakened immune systems, particularly those living with HIV/AIDS. However, it is important to note that it can also occur in people without these conditions, particularly in older adults of Mediterranean or Eastern European descent, or as part of an uncommon condition called classic Kaposi sarcoma. These lesions tend to grow slowly in immune-competent individuals, but they can progress more rapidly in those with compromised immunity. The lesions caused by Kaposi sarcoma may not initially cause pain or discomfort, making them easy to overlook or dismiss. Over time, however, they can become tender or even ulcerated, leading to bleeding or infection. When the disease affects internal organs, It can result in symptoms like difficulty breathing, digestive issues, or blood in the stool, depending on the location of the tumors. If you notice persistent discoloration or lumps on your skin, especially if they are blue or purple and do not fade, it's essential to consult a doctor for further evaluation. A healthcare provider may perform a skin biopsy or imaging studies to confirm the diagnosis and determine the extent of the disease. Early detection and treatment are crucial, as they can help manage symptoms, improve quality of life, and prevent the progression of the cancer. Paying attention to these subtle skin changes could make a significant difference in catching Kaposi sarcoma early, when it is most treatable. 6. Brown spots on nails. Brown or black streaks under the nails can be more than just a cosmetic concern. They may be an early warning sign of subungual melanoma, a rare but aggressive form of skin cancer. Unlike typical discoloration caused by trauma or staining from nail polish, subungual melanoma often appears as a single persistent dark streak under the nail that doesn't grow out as the nail grows. Over time, this streak may widen or darken further, and the nail itself may undergo changes, such as becoming brittle, cracked, or deformed. This condition most commonly affects the nails on the thumbs or big toes, but it can occur on any nail. While subungual melanoma is more common in people with darker skin tones, it can affect anyone, regardless of age or ethnicity. Because nail discoloration is often attributed to more benign causes like fungal infections, injuries, or bruises, many people delay seeking medical evaluation, allowing the cancer to progress undetected. If you notice a persistent dark streak under your nail that doesn't improve or resolve over time, it's essential to consult a dermatologist or healthcare provider promptly. Additional warning signs include pigmentation extending onto the skin around the nail, a phenomenon called Hutchinson's sign, or unexplained pain or swelling in the affected finger or toe. A dermatologist may perform a biopsy to determine whether the discoloration is malignant. Early detection of subungual melanoma is critical for successful treatment, as this type of cancer can spread to other parts of the body if left untreated. By paying attention to changes in your nails and seeking prompt medical advice, you can significantly improve your chances of catching and addressing melanoma in its early stages. 7. White or grayish patches in the mouth. White or grayish patches inside the mouth or on the tongue, medically known as leukoplakia, can serve as an important early warning sign of oral cancer. These patches often appear thickened, slightly raised and rough in texture, and they may be located on the tongue, gums, inner cheeks, or the roof of the mouth. While they are usually painless in their early stages, their presence should not be overlooked, as they may indicate abnormal cell growth that could develop into cancer over time. Leukoplakia is commonly associated with lifestyle factors such as tobacco use, including smoking and chewing tobacco, heavy alcohol consumption, or persistent irritation from ill-fitting dentures or rough teeth. Additionally, infections caused by the human papillomavirus, HPV, are increasingly recognized as a contributing factor to oral cancers. These patches may persist for weeks or months, and in some cases, they may develop alongside other concerning symptoms, such as unhealing sores, difficulty swallowing, a sensation of something stuck in the throat, or unexplained weight loss. It's important to note that not all white or grayish patches are cancerous. However, persistent or recurrent patches should always be evaluated by a healthcare provider or dentist. A thorough examination, which may include a biopsy, can help determine whether the leukoplakia is precancerous or cancerous. Early detection is critical, as oral cancers are more effectively treated when identified in their initial stages. Ignoring these patches can lead to delayed diagnosis and more advanced disease, making it crucial to pay attention to any unusual changes in the mouth. Routine dental checkups and avoiding risk factors like tobacco and excessive alcohol can reduce your chances of developing oral cancer. 8. Pink or bloody urine. Pink or bloody urine, known medically as hematuria, is a significant warning sign that should never be ignored, as it could indicate bladder or kidney cancer. This discoloration occurs when blood is present in the urine, often due to tumors in the bladder or kidneys disrupting normal tissue or blood vessel integrity. While hematuria is one of the earliest and most visible symptoms of these cancers, many people dismiss it, assuming it is linked to less severe conditions like urinary tract infections, kidney stones, or vigorous exercise. It's important to distinguish hematuria related to cancer from other potential causes. For example, While UTIs and kidney stones often cause pain or burning during urination, blood in the urine caused by cancer may not be accompanied by these symptoms in its early stages. However, as the disease progresses, additional warning signs may develop, such as persistent back or flank pain, a frequent need to urinate, difficulty emptying the bladder, unexplained fatigue, or weight loss. If you notice pink or bloody urine, even if it seems to come and go, it's essential to seek medical attention promptly. A healthcare provider may perform a urinalysis to detect blood and rule out infections, as well as imaging tests such as ultrasound, CT scans, or cystoscopy to examine the bladder and kidneys for tumors or abnormalities. Early detection of bladder or kidney cancer is critical, as these cancers are often more treatable when diagnosed before they spread. If you or someone you know notices any of these unusual color changes, don't ignore them. Consult a healthcare provider for a thorough evaluation. It could save a life. If you found this video helpful, give it a thumbs up, share it with others, and subscribe to our channel for more life-saving health tips and information. Together, we can raise awareness and help people take charge of their health. Stay informed, stay healthy, and we'll see you in the next video.